All right, good morning. Welcome to the weekly briefing for the COVID-19 response from the state of Utah. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety. Today we are going to bring you a variety of speakers, including Dr. Angela Dunn from the Utah Department of Health, Governor Herbert, Speaker Brad Wilson, President of the Senate Stuart Adams, and then our Lieutenant Governor Spencer Cox. So we will turn the time over to Dr. Dunn.
Thank you, Joe, and good afternoon. So our 7-day rolling average today is 381. This is a decrease from last week when it was 394. And our 7-day rolling average of percent positivity is 9.1%. That's a decrease from 9.4% last week. So I've been getting a lot of questions about what is percent positivity. And I want to take a moment to explain it. It's a measure of how well we are doing at testing and also a measure of the spread of COVID-19 throughout our state. So to calculate it, of course, we have the number of people tested divided by the number of positive tests. So the ways to decrease percent positivity is to increase the number of tests we do or to decrease the spread of COVID-19 and decrease our cases. When our percent positivity is high, there is a chance that we're not identifying all of our COVID-19 cases. So this means we need to test more. The White House has established some criteria for percent positivity. The White House defines a high percent positivity as greater than 10% or in the red zone. 5 to 10% is considered warning or in the yellow zone, and less than 5% is considered low or in the green zone. So given that percent positivity is a combination metric of testing and COVID-19 spread, it does continue to be a key metric that public health uses to understand where we are in the course of this pandemic, as well as determine what interventions need to happen. Thank you.
Thank you, Dr. Dunn. We appreciate, as always, the work Dr. Dunn's doing. She's done a lot of heavy lifting, a lot of work over the past little over 7 months since we began this, and we appreciate her efforts. In fact, as I reflect on that back in March, when we kind of started on this journey, this quest, it was really what could we do to assemble the best minds in healthcare and medicine and science, the best thinking that we could find to help us develop a plan on how we're going to go forward addressing this pandemic. And again, as we all know, this is really somewhat new. This is a novel virus. We're learning as we go, and the challenge we have as far as what is good policy. I'd like to make sure that we understand there's a distinction between the health care we take as individuals and our personal health needs and the public health care needs, which are a little broader. And really, what is the role of government and helping us to make sure that the community at large is safe, that it's healthy, that it has every opportunity to protect its own personal health. And we've had to look at different kinds of scenarios, and the what if questions have been asked many times, and looking at what is the best possible scenario for us to make sure that we have the optimal policy for helping address the healthcare of as many people as we possibly can. And of course, as we've always said, it's kind of a balance because it's not just healthcare. It's also what can we do to make sure that the health of our economy is preserved also at the same time. I think our response to this pandemic has been stronger than it's ever been done for generations. You have to go back to the Spanish flu epidemic of 1918 to find anything that's similar. And that was a large worldwide pandemic where we had up to 50 million people that died. Healthcare was not as good back then as it is today, and so we should be doing better, and we are. But some of the same things they did back then are some of the same protocols we're taking advantage of today. We've encouraged people to wear masks, just like they did back in the Spanish flu days. We've encouraged people to have social distancing, physical distancing one from another, so we slow the spread of the virus. And we have limited, in some ways, how people gather. And that's helped us, in fact, to get turn this coronavirus pandemic around. and we hope to do even more as we go forward. But those efforts are not unique to our time, as they're certainly not unprecedented because it's been done before. But public health care does work. The fact that we all work together in collaboration and cooperation is helping us, in fact, get on top and turn the tide on the spread of the coronavirus. And we appreciate all those who are a part of that effort and your participation. And we invite everybody to work with us together on that. Early on, our needs were, this was kind of a sudden impact on our state at the first part of this year, again, March, when we first declared an emergency. Our strategy there was to make sure that we met the PPE, the personal protective equipment needs, particularly of our medical community. They were in short supply. That was our number one goal, make sure we had PPEs for our medical people to be able to handle the deluge of people that were getting sick and heading into our medical facilities, doctors' offices, and some in the hospitals. We wanted to increase testing so we could find out who had the COVID-19 virus and help isolate those folks so that they did not spread it to others. 3, we wanted to get the transmission rate down so that rather than growing and increasing the numbers, that we'd eventually stabilize and decrease the numbers, which is where we're at today. And also, last but not least, preserve hospital bed space. And we've been really very good at that. In the purchasing of our PPEs, again, we, under emergency situation, we needed to do that in a very rapid way, hence the emergency declaration. We spent about $42 million on PPE equipment for our medical people and for others. We have orders of $44 million for additional supplies. And we now have a comfortable cushion of these supplies to help our hospitals get through in case we have a resurgence. If we have an increase in infection rates, that we have a surge, we're prepared for that now. We hope for the best, but we are, in fact, preparing for the worst. I think that's prudent. By the way, again, there's a number of questions that have been raised over time about some of the purchases that were made. We've mentioned this before, but I'll mention it again. We have a web page called purchasing.utah.gov/COVID-19. That's purchasing.utah.gov/COVID-19, where you can find the list of all the contracts we've entered into as we spent this near $100 million on personal protective equipment and the supplies and needs we had, in fact, to get in front of this. As you recall, this was a global competition, and there was no place to go. The federal government really said, the states, you're on your own, and we had to go out there in a very rapid fashion, procure this equipment we needed to combat the coronavirus. We've tried to be open and transparent in all that we've done, and this webpage will help, again, if you have any questions about some of the contracting. The results of our efforts have been good. We're not saying it's time to declare victory in this war on the coronavirus, but in comparison to other states, we've done very well. Our transmission rate is low. Our average case load is now around 400. We wish it was lower, and we're going to work towards getting it below 400. Our hospitalizations, we're in very good shape there. They are low. 118 hospital beds being occupied today. We are only using about 6%, maybe 7% of the ICU units are COVID-19 patients, so a small percentage, and only about 2% of overall hospital beds. We have about 50% of our beds. There's about 2,500 beds that are still available out there in our hospital facilities. So that's good. We've not overwhelmed the hospital system or the healthcare system, which is a key as opposed to other areas of the state or other areas of the country and the world, for that matter. Think New York, where they had an overwhelming of their healthcare system and consequently a lot of death. We haven't had that. We have a lot of ventilators. We've not even come close to overwhelming the need for ventilators. So by the measures that we have in place, we've done very good in acquiring the equipment necessary for our healthcare professionals. Now we're at that stage as we see good things happening. We're not going to rest on our laurels. The question is, what can we do now even better? We're learning more as we've gone down this road on the coronavirus, and we want to look and see how we can refine our goals, modify them, modify our strategies so we have even better outcomes going forward and continue more progress. We are concerned now as we head into the fall. We have schools now reconvening. We're going to have more indoor activities now and less outdoor activities. We have a concern that that's maybe more conducive for spreading of the virus when you're indoors as opposed to outdoors. And so we're having some very important and deep discussions on what do we do now? What's the next chapter? And how do we address this to make sure, again, our public health care is appropriate and doing the best we can, and our economic health remains viable and continues to provide jobs and economic opportunity for us as a state. So we're going to stay focused. We're going to make sure we have the right efforts in place to provide the best protection for public health and economy. And the key operational policy word there is balance. We've done a good job of finding the appropriate balance point to protect the public health and welfare as well as protect the health of the economy also. Now, I appreciate the fact that Speaker Wilson has been at the forefront in the formation of the goals we've had in the past and the formation of goals we're having going forward here. So I've invited him to come and speak about how we hold ourselves accountable. We want to be open and transparent on behalf of the public, knowing what we're doing and feel comfortable and confident about what we're doing and how we're doing it. After he speaks, we'll invite President Stuart Adams to discuss how we all are working together, have been in the past, and how we'll continue to be working together in the spirit of collaboration and cooperation will help us win this war on this pandemic and the coronavirus. So with that, Speaker Wilson.
Thank you, Governor Herbert. It's great to be with you today, and we really appreciate your leadership and the hard work you've put in this year for the state and our citizens. As we start to face big challenges in life, as we face big challenges in business or in government, or even as a matter of public health and economic strength here in the state of Utah, I find it really helpful to think in terms of wars and battles. Wars are won by focusing on the battles. If we win enough battles, you emerge victorious in the war. As our war on COVID-19 moves into the autumn, we will be met with some new challenges, some of which we haven't even thought of right now. And it becomes even more important that we are fighting the right battles. Educators across our state have worked really, really hard and tirelessly to find the best way to teach our kids across the state. We need our kids in the classroom. We need them in the classroom learning. We need them in our schools, taking advantage of the services that our schools provide, whether it's meals or mental health services or even the social benefits of being in schools. Our families have really struggled at times to juggle the challenges that COVID-19 has brought upon them, and they've had to adjust the balance of their family and work responsibilities. And they need to know that our healthcare system is there at the ready to take care of them in case of anything that might happen to them, including contracting the virus. And our economy in Utah is very strong, the strongest in the country. What a blessing it is to live in Utah. We want to make sure we keep our economy that way. People in the state are hiring right now, and we need to make sure that continues to be the case here in Utah. So as businesses across our state continue to show remarkable determination and adaptability to a constantly changing set of circumstances, we need everyone to understand that we are not at the finish line with COVID-19. We're maybe at the midway point. There's going to be a lot of work to do this fall and this winter and this spring as we continue to manage through this virus. On behalf of the members of the House of Representatives, I want everyone in the state to know that we see how much you are doing, and we appreciate the efforts and the great work that you've done to make Utah and show what Utah has to offer. So in this structure that's being rolled out today, we've opted to use different terminology. The Utah Leads Together Accountability Framework outlines the mission and its two major goals, the objectives that we need to accomplish and how we need to focus to emerge victorious in this war. Accountability is absolutely critical. The public not only deserves to be informed about what's going on as we lead through this, but all Utahns need to be involved and do their part in this effort. We absolutely cannot get distracted. We need to stay focused on the public health of our citizens. We need to stay focused equally on the economic health of our economy. These two interdependent elements of this structure are going to make us successful in the long term. There are absolutely reasons to be optimistic. The governor's done a great job of outlining those. And there are clear indications that Utah is on the right track, maybe arguably more than any other state in the country. But now is absolutely the time to refocus and redouble our efforts as we prepare to move into the fall. I want to thank everyone across the state, in government and the private sector, who's been involved in thinking through this accountability framework. Those that you see here in the media, those that you see here at the media event, as well as many others that have provided their expertise to the state. Thank you. President Adams?
Thank you, and appreciate the great work that both the governor and the speaker have done. And as we work together, I think that is one of the things that has made Utah so successful. As I think about the last 7 months, as the governor mentioned, how long it's been since we first heard the words COVID, at least the cases came to Utah. I look over that period of time, there's a lot of things that we can think of that are positive. In fact, in Utah, our case fatality rates used to be 1.1%, but they're now the lowest in the nation at 0.8%. The United States actually has reduced their fatality rates from 5.9% to 3.1%. In the world, they've reduced their fatality rates as well from the beginning rates of 6.9% to 3.5%. So those are all good news. But as we look at data and we look at these new goals and mission, it's very important that we don't focus on any one particular. And maybe to illustrate that, let me explain that if we simply look at case rates, if we have 800 cases per day, and heaven forbid we go back to that level that we experienced in Utah, if all of those cases were 22-year-olds, it's very unlikely that our fatality rates would increase, nor would our hospitalization rates increase, because those are healthy 22-year-olds. But if only 400, half of that 800 per day, if we had 400, which we are today, and all of them were long-term care facility patients with comorbidities, meaning other medical conditions, both our hospital utilization would probably skyrocket. We'd overrun our hospitals, as well as we would have an increase in fatality rates. And we know as we look at COVID, we can self-isolate and we can try to stop the spread. But as we do that, we have to look on a holistic basis. So it's really important that we not look at any one item. And this new mission and goals has a broad base. Let me explain a little more. As if we were to self-isolate, we know that we're seeing increased case counts, or at least calls into the Mental Health Crisis Center. We've had a 30% increase. We also know that people are a little bit hesitant to go see their medical providers. And we know that when they do that, the acuity levels in the emergency room increase, and actually the increased hospital admissions from regular lack of medical care actually increases. So we have to look on a holistic basis. I think this new program does that. And again, thank the efforts that have been put together to make metrics that actually help us manage as we go forward, to look at it on a holistic basis. It's, again, important that we stay together and we work unified, and I think we are in the state of Utah, and appreciate the governor and the speaker and their great leadership. Thank you.
Thank you, President. Thank you, Speaker. I'll just add here, it's been a great, as we work through this significant, challenging year of 2020, the fact that the legislature and the executive branch have been really in lockstep, virtually on everything. We do have some small disagreements, but it's been a joy to work with the legislature. We appreciate the good work of them in helping us get through this. So thanks to the Speaker and the President. Next, we're going to have an opportunity to hear from our Lieutenant Governor, Spencer Cox. Spencer's been involved with our original workings with the COVID-19 task force, which now has become the unified command central that we have here, with his direct involvement there. He's been helping us develop the plans along the way as far as what we've been able to do and how we've been able to do it. And so we'll have him come in now and tell us about the next chapter. So Lieutenant Governor Cox.
Thank you, Governor, and thank you, Mr. President, Mr. Speaker, for your incredible work. As the Governor mentioned, we love to focus on the divides that sometimes happen. There is a natural tension between the executive branch and the legislative branch, and those make for better stories, for sure. But the truth is, and especially over the past several months, we've been able to work very closely with the legislature and legislative leadership in combating this virus and in finding a path forward, threading that needle in making sure that we preserve the health of our citizens and the economic health of our state. We're so grateful for their leadership. It's been now, gosh, almost maybe a month and a half ago, maybe a little longer, that I got a call from Speaker Brad Wilson, and we started talking about where we were and where we needed to go. Just a brief history of this, and I have to start with a quote. They're tired of me sharing, but it's one of my favorites. I think it's an important one. Something that Judge Oliver Wendell Holmes said many years ago. He said, "I would not give a fig for the simplicity on this side of complexity, but I would give my life for the simplicity on the other side of complexity." Now, it's a little confusing the first time I read that, but he's talking about there are two types of simplicity, one on this side of complexity and one that follows complexity. And that's certainly been the case when it comes to our coronavirus response. When we started in February looking at the landscape and what might be coming our way, and then in early March, the governor asked us to convene the coronavirus task force, and we brought in experts in all kinds of from different places, from public health, of course, our medical professionals here in the state, professionals from education, on the economic side, religion. We had everyone represented in that room, and we gave advice to the governor and to legislative leadership on decisions that were being made. Over time, that response got more and more complicated as we brought together, as the governor said, the unified command, to the point where we have about 250 people that meet 3 times a week to work and talk about these issues. That's the complexity. We went from the simplicity of a small group of people talking about these issues to 250 people. But with complexity comes the temptation to lose focus. When you're working on all the things, sometimes we lose sight of what matters the most, while all those things are important. And what we're looking for now is a simplicity, this informed simplicity that comes on the other side of complexity. And we want to talk a little bit about that. So what we've done, and again, I know this may not be interesting to everybody, but I think it's really important, and we're going to give some resources to the media and of course to citizens of the state that are interested in where we are in the response and what really matters, what is going to make the difference. So we talk often, and we've talked today about the health side and the economic side. And what we've done is we've really narrowed that into 2 major goals. These are the And let me just point out, we have a new scoreboard, as we refer to it, that we're going to share with you today, that will show these goals and then all of the objectives and lead measures that follow behind those goals that will help drive us. But as Governor Herbert always says, we need to start with the end in mind. And what are those major goals? So on the health side, our major goal is to make sure that our case fatality rate stays below 1%. We want to constantly be lowering that case fatality rate. If we can save lives, we won't overwhelm our healthcare system. We'll keep people happy and healthy, and we'll be able to get through this. Now, there are lots of different ways to do that, and those are the objectives that I want to talk about. On the economic side, we want unemployment we want to be able to maintain unemployment under 4.5%. Now, we're very fortunate to be the first state to hit 4.5% this last month. We set that goal of 4.5% before we hit 4.5%, but we also know that those are very soft unemployment numbers, and there's the opportunity for them to bounce around over the next few months. We want to continue to lower that rate and get people back to work. And so the metrics are becoming more sophisticated all the time. So let me just share some of those that, for example, on the health side, what are the dials that we can share or that we can move that will keep that case fatality rate under 1%? And Brooke, if you want to pull up we can pull up that scoreboard, and she can kind of scroll through some of these. But some of the metrics we're monitoring on the health side is of course, the 7-day rolling average that Dr. Dunn talked about today, number of cases per day, the statewide ICU utilization, which the governor mentioned. Those are important metrics. Specifically, as President Adams mentioned, our long-term care facilities, about 45-ish% of the fatalities that we've seen in this state have come from long-term care facilities. So they deserve an extra measure of protection. We're also monitoring important demographic data, like for example, for vulnerable populations. So not just the age data, but other demographic data. We've previously discussed our Hispanic or Latino populations who are disproportionately suffering from this disease. They make up about 14% of the population of our state, but they represent, they were over 40% of the cases. We've been able to bring that down now, I believe, into the 30% range, and so we're doing better, but we still have a long way to go there. And so what we're doing is we have made assignments on these objectives and lead measures to people within this response team. So the Department of Health, of course, being led by Rich Saunders, and we're so grateful to have Taylor Randall, the Dean of the University of Utah Business School, who's helping to lead out on the economic side. And with Jess Anderson and the Unified Command unifying all of these approaches. And then underneath each of them, people are given direct responsibilities for these objectives and lead measures. And every week they report out on what they are doing, what they did the last week to help move that scoreboard from red to green, making sure we're headed in the right direction, and what they're going to do next week to make that accomplished. So it's a way to hold people accountable, to hold the state accountable for our response as we work closely. I want to talk just briefly about some of the economic measures as well. As I mentioned, to bring that unemployment number and keep it under 4.5%, continuing to reduce that. So just a couple examples. We have one of the objectives is we want the consumer confidence index to increase to pre-pandemic levels. Now, we have not historically tracked the consumer confidence index here in the state of Utah. We, of course, do that nationally. We're starting to do that now. We're grateful for our partners at the Gardner Institute who are helping us with some of these measures, and we'll be doing constant surveying of the public to find out where consumer confidence is here in the state of Utah. Underneath that objectives, we have some lead measures. For example, one of those measures is to do outreach to more than 1,700 Utah businesses every week, helping them take the Stay Safe, Stay Open pledge. If our businesses are practicing safety measures, people will feel better and feel more confident going back to stores, going back to doing business if they know that they've lowered the risk of contracting the coronavirus there. We're working to reduce the number of cases associated with the work site to less than 70 per week. We'll be targeting specific industries, those that have seen the highest rates of infection. We'll be working directly with industry leaders there to help implement best practices and lower those outbreaks. And then we want to increase awareness and participation with business support programs. We've been very fortunate with the CARES Act funding, with legislative funding that has been given. There are grants available for businesses to help implement those safety measures and keep their doors open, which is important. Another objective on the economic side will be to increase job placements so that we lower the weekly unemployment filings to under 50,000. And we're moving in the right direction. As you can see from the chart there in front of you, we're headed there, but we want to get that below 50,000 and continue to do that. So again, underneath that, and people are assigned to work on these, we have lead measures. We'll be tracking how to connect people directly with jobs in the exchange program. We do have jobs available right now, but sometimes we're having a hard time connecting people who need jobs with those jobs that are available. We'll also be targeting industries that have been heavily impacted by the pandemic with specific support to aid in reactivation and creating employment opportunities for them. So, of course, the leisure and hospitality has been hit really hard. We'll be working directly with employees in those venues, getting them back to work as quickly as we possibly can. And finally, one last objective that I'll share is to increase enrollment in industry-aligned short-term educational programs to pre-pandemic levels. This is something that was important to us before the pandemic. It's more important now than ever, and will be important after the pandemic. And that is making sure there's better alignment between those that need jobs and the jobs that are available, which means we have to do better educating people, re-educating people, upskilling people who are already in the workforce so that they can participate in the incredible economic growth that we've had in the state of Utah and that we will continue to see moving forward. So in this measure, in this objective, we are working with our UTech campuses across the state, with our other institutions of higher learning to give people an opportunity to get certificates and improve their training and their skills. There is a huge need for highly skilled workers in this state and across the country. And if you're one of those people that is struggling right now with your employment, there's never been a better time to go back. Sometimes in just a matter of weeks or months, you can get a certificate and add to your employment possibilities and find one of these good high-paying jobs that is available right now, and which employers are desperately needing good workers. So I'll just conclude by ending where the governor started, mentioning that we are heading into the fall and winter months. We do know that there is a potential as we move inside. There was a great article today in the Atlantic that talked about some of the mistakes that we make as human beings thinking through a pandemic and as policy leaders. And one of the problems is we're always looking for that silver bullet, that one thing that's going to fix all of this. And what we've learned over the past several months is it's not one single thing, but it's all of these things together. Mask wearing is so important. That's one of the metrics that we have on the scoreboard as we're constantly surveying and finding out how we're doing on mask wearing. But that alone is not going to solve it. We have to do all of these different things, both on the economic side and the health side. That's how we're going to get through this pandemic together. Again, we're so grateful for the leadership in the state, but most importantly for the citizens of the state of Utah who are working together to solve every problem that comes, whether it's a hurricane that hits the Wasatch Front this week or a global pandemic. We're here together, and we appreciate everything that you're doing. Thank you. Governor?
Well, thank you, Spencer. We appreciate all the work you've done. And again, we appreciate the legislature and the work that they're doing and will continue to do. As we kind of wrap up here, let me mention a couple of things, and then we'll open up for questions. We've had a number of requests from our various counties to be able to shift to green color, which means less restriction. And we're going to grant today, effective Friday, Box Elder and Carbon counties will be allowed to move to the less restricted category of green. I want to emphasize to people this doesn't mean that the risk level's gone down. In fact, in some instances, because you now have the ability to have more social gathering under a green condition, you might have even higher risk. So again, a word to the wise, be careful. Wearing the mask is still a good policy, social distancing, good hygiene. So, but effective Friday, Box Elder and Carbon counties will go to a green designation. We have some others in the queue we're working with closely to see if they can, in fact, bring some of their data statistics into more stabilization. And we would anticipate that will happen, and other counties will have the ability to shift into green in the near future. Last but not least, again, 2020 has been really a challenging year. When you think about fire, floods, earthquake, the pandemic, free fall of the economy, rioting in the streets. I mean, we've just had about everything, and 2020 continues to surprise us all as we've just concluded here having this this windstorm of magnificent proportion. Reminds us of 2011, which was similar but smaller in size. The magnitude of this one, Category 1 winds from as far away north as Logan down to South Salt Lake County. Some impact down in St. George area, from Vernal to the west part of the Wasatch Front. It's carried quite a big swath of devastation with these winds. And we're in the process now of cleaning that up. I appreciate, as I've been out and about, to see the volunteerism, which is a hallmark of Utah and our culture, to people getting out looks like a little anthill out there with people going with their saws and their chainsaws and their trucks and their wagons to be able to pick up and clean up all particularly the trees that have fallen, the limbs and the clutter that's out there. Again, we can't thank the people of Utah enough. Government can't do it all, and the fact that we are augmented so much by the volunteer efforts of our local communities is really encouraging. It's the kind of people we are. We care about our neighbors, and we see that demonstrated during these difficult times. So thanks to people that are doing that work. Certainly local governments with volunteers are doing the bulk of the work. The state has a role to play too. We've activated today our Department of Transportation. Particularly they'll be over in the Rose Park area today to help clean up the clutter there and the fallen trees and limbs and other things that need to be cleaned up. We'll have some volunteer work with some of our staff members taking time to do that to help. And we're also going to activate some of the National Guard, bring in some of their equipment, work with UDOT, and again, help clean up some of the neighborhoods that need a little extra help here over this next week. So again, talk about collaboration. That really is the secret of our success. Public-private partnerships all working together for the common good of cleaning up this significant windstorm devastation that's been left these last 2 days. So with that, again, we appreciate the good work of our citizens. It really is you doing the bulk of the work and helping us to succeed. We ask you to continue to be mindful of the issues out there and conduct yourself accordingly. With that, we'll be happy to answer some questions now for any that have any.
Hi, this is Haley Hendricks with ABC4. My question today is for Dr. Dunn.
Dr. Dunn? Here she comes.
Hi, Dr. Dunn. So I've got a two-part question for you today. First part is, how many Utons are we currently testing daily?
So, I mean, it fluctuates every day, but we're testing somewhere between 3,000 and 4,500 pretty consistently over the past couple weeks.
Okay, so if we were to hypothetically say increase our testing up to 9,000 per day, would we average around 900 confirmed cases? Essentially, I'm asking, if we increase our testing, do we see an increase in confirmed cases?
Right, so that's the question. I mean, hopefully not. When we have about a 10% positivity, the idea is that we are likely missing some cases out there that aren't getting tested. But what we've seen in other instances of this pandemic is that the more testing you do, the more likely you are to catch everybody who has COVID-19, but also catch a lot of people who don't. And so your percent positivity goes down. And so I'm hopeful that we don't have, 900 cases out there every day, equating to about 400 or 500 that we're missing every day. But that's why we do need to test more people, and we're working towards that.
What efforts are you guys taking to hopefully ensure you get more testing?
Sure. I mean, what we've noticed is definitely a decrease in demand for testing over the past several weeks. Our testing centers just haven't had, the amount of people waiting in line to get their nasal swabs, to get that test done. So we're working towards getting access to more rapid testing that doesn't have that barrier of having a nasal swab or needing all that PPE. And then definitely, of course, we're always pushing the messaging around. It is so important for anybody with any symptoms or those who are close contacts or in a high-risk setting to go ahead and get tested. But we do realize that there is a lot of kind of barriers out there that we're fighting against in terms of increasing the testing.
Great. Thank you for all you guys do. Appreciate it.
Yeah, thanks.
Next question.
Hi, Governor Ross Terrell with KUER. You mentioned more counties are moving to the green and much of the state's in the yellow. What's your biggest concern moving forward as this pandemic continues? Is there any concern that people won't continue to take it as seriously as they need to?
Well, I think my biggest concern is one of complacency, that people think, we're really out of the woods and we don't need to comply with some of the recommendations given out there. A little lackadaisical on wearing of masks. As we get indoors, we saw with Brigham Young University, which is taking significant efforts of mandating mask wearing on campus with our students. Yet off campus, some of the students have been conducting themselves in very close quarters with no mask and no social distancing. And that's really a situation that could, in fact, increase infection and transmission rates. So we're concerned about people not just following good protocol. I know it's a sacrifice and it's certainly an inconvenience. But if we're going to, in fact, get through this thing over the next year, we need to, in fact, sacrifice and tolerate some inconvenience. And if we do that, I think we're going to be fine. So that's my biggest worry, is people just going to become lackadaisical about following protocols.
Awesome. And I have one question for Dr. Dunn.
Dr. Dunn?
Go ahead.
So we saw at Utah State University, if I'm not mistaken, they were able to get ahead of a potential outbreak by testing sewage and seeing that there was an elevated level of COVID-19. Is that something that can be used more widespread and not in university settings, but in entire counties and communities? Is that something that you're looking at?
Yeah, absolutely. I mean, this whole initiative started as a community initiative to test wastewater for the SARS-CoV-2 virus that causes COVID-19. So we have been doing that, working with our University of Utah and Department of Environmental Quality partners who have been leading that. This is definitely the cutting edge of the COVID-19 pandemic nationally. A lot of people are looking to Utah for how we're using this. So we have a dashboard set up, and we've seen fluctuations in the amount of virus that they're able to get from the wastewater. And it does correlate on a population level with the number of cases we're seeing. So for example, when we have seen that drop in cases in certain communities, for example, Salt Lake County, but we also saw a drop in testing, we were confident that the drop in cases was real because the wastewater also showed a decrease in the virus detected. So we are currently using it, but of course this Utah State University is a use case and a new way to use it. And we'll be working really closely with the local health department there in Utah State University to figure out lessons learned and how we can use this better moving forward.
Next question?
Hi, can you hear me okay?
Yes, Aaron, go ahead.
Thank you. So looking at the goals, especially on the health side, what, if any, action do these various thresholds trigger? For example, we went over 400 new cases last week. Shortly, now it's back down again, but only kind of by a little. Is there any plan to do anything specific if that happens again?
Lieutenant Governor, can you come talk about that?
So with all of those goals, again, there are many sub-goals or these lead measures that are driving up towards that. And so anytime we see movement, especially movement towards the red, that triggers the groups that are responsible for those objectives to get together to talk about what can be done to lower them. So, again, we mentioned mask usage. What's happening? What does that look like? We just mentioned the wastewater data. That's very important. I'll mention on the other side of that, Dr. Dunn said, something positive, that there was a decrease in Salt Lake. What we are seeing is high numbers in Utah County right now on the wastewater side as well. And so what we're also trying to do is get more localized in our response. That's always important, and reaching out to those localities to see what's being done there and making sure there's follow-up. So yes, with every one of those, there aren't specific triggers, but they lead to a discussion, and then those recommendations go through the Unified Command to the governor if it's something that needs to be done on that side, to local health departments, to local officials, whoever is best situated, or everyone to make those decisions that can help drive those numbers. Everybody's included in that discussion.
Okay, thank you.
Let me just add, too, that, again, it needs to be stated that the Unified Command meets every day. They look at the new numbers, the new data, they do the analysis. They inform those who need to know, whether it's a local health department, you're having a spike here, you're having a challenge. We're concerned about Utah County really now leading the state when it comes to the infection rate. That's something that we're concerned about, that the local health department down there needs to be concerned about, and the local elected officials. I think they're trying to address that, and we appreciate that. So we'll nudge them as we can. We also make sure that we are informing the legislature so that they're aware of what's taking place and any, in fact, changes we're going to make in policy. Right now with the schools in session, that's a big issue for us as far as what do we do if we have 3 infections. There's recommendations that have been given, standards that need to be followed based on what the health departments have said, then in conjunction with the plans that the local school districts have put in place. But it will trigger, if you had 3 infections, for example, in the class, it'll trigger a review of what do we do to quarantine. Do we quarantine the class? If they all happen to be from the same family, probably not. If there's widespread infection in the class, maybe the quarantine would be warranted. But it triggers a review and a discussion to see what would be the best practice going forward. That's a constant reoccurring event. And I expect that will happen until we finally get a vaccine.
Yes. Hi, Governor Herbert. I have a quick question. You've said that one of your biggest concerns moving forward is people being lackadaisical about following some of these protocols. And I know in the past you've held off from instituting a statewide mask mandate, but you have said that it remains a tool in your arsenal. I'm wondering if that's something you would consider enacting if cases continue to plateau as they have, or if they increase in the event of a possible second wave.
Well, there's a lot of tools in the toolbox that can be used. We've tried to do this with not the heavy hand of government, but more of a velvet touch. I'm a believer in a couple of things. One, I don't like a one-size-fits-all approach. I think there are variations in our regions and our communities. And so those need to be accounted for by the local elected officials that are responsive and elected by the people in that community. So local control, I think, is an important aspect of this, along with not avoiding a one-size-fits-all. So again, I think we're doing pretty well, all things considered. And we've tried to find that right balance point where we, in fact, are helping with the public health. We have individual responsibility, which is an important aspect of this. What is your responsibility to maintain your own health and do what you need to do to do that? So individual responsibility, the government has a role to play, and particularly in providing for the public health and welfare, and that's happening now. But then we also are concerned about economic opportunity. There's a downside to a poor economy. In fact, if you look worldwide, those that have the poorest economy have the greatest health risk. So the fact we can have a healthy economy, it helps us have better health care, which we've done. And we ought to also recognize the preparation that's been done. Again, thank our legislators here. We've got the 2 leaders of the House and the Senate, and having a rainy day fund. They've procured significant amounts of money to help us prepare for the pandemic as soon as we found out. But the work that's been done for the previous 10 years in developing rainy day funds, being fiscally prudent, we're in a position that most states don't find themselves in. There's only 9 states in America have a AAA bond rating from the rating agencies on Wall Street. We're one of them. That's thanks to the good work of our legislature in being fiscally prudent. That's all works together. It's not one single thing, as the Lieutenant Governor says. It's not a silver bullet. It's really everything working together in concert. And we're playing a lot better music than most of the states out there right now. Last question, I understand. Anything for the legislature? We got them here, so. No question?
Yes, thank you.
Okay.
Thank you, Governor. This is Chris True with St. George News. And this is a question for you, and certainly the legislative leaders can chime in on this. But you mentioned when talking about counties that have moved green, you did include Washington County and Iron County, which have made the request. You also talked about the need for stabilization. Was that directed towards Southern Utah? And as a follow-up, the local health department, the leader of the local health department here, has criticized the governor's, your office's response to this, saying that you mentioned about local control, but they don't feel like they have enough local control to, let's say, move to green. Can you respond to that?
Are you talking about Washington County local control?
Correct.
Yeah.
Southern Utah.
Well, it's a combination of the local control. They certainly make the request, and they base that on data. Clearly, somebody could be in a very significant influx of infection and say, we'd like to move to a less restricted category. That's a little hard to do if the data doesn't justify it. So it's not a matter of just making the request. It's also having data to back it up. That includes the local health department in their region. And then that's reviewed by the state health department based on the protocols we have in place. If you meet those protocols, and Washington County and Iron County, for example, are getting close, but there's a few areas of transmission rates that are a little bit too high to justify that. We are also in a kind of a tenuous time with schools coming back into session. And so what does that get impact? As well as we'll start getting into the fall months where people will start traveling to the southern part of our state for vacation time. And so that causes a little bit of pause, and we want to be a little bit cautionary about that. What we don't want to do is move to a green category and then have to come back later on and move back to a yellow category. So we're trying to have an abundance of caution, being prudent as we move to make those designations. But again, stabilization and having some distance of having good numbers, so, you know, for a couple of weeks, that shows stabilization. That makes it a little easier. They haven't had that yet. Senator, before you go, would you like to just say a closing word here about what we're doing?
Thank you, Governor. I appreciate the question and appreciate the opportunity to be here. Specifically to the question about St. George, I think we passed a statutorial legislation in our first special session that gave some guidance. I think it was Senator Herbert's bill that actually said that local jurisdictions could actually be less restrictive than what the governor's recommendations were, but they couldn't be more. And so I think as we walk through this, I think, again, we're trying to balance this around the state. We've got positive news. We have the lowest unemployment rate in the nation. And I think those are good numbers, and that's part of these statistics we have. But there are some issues that we have. Not that we have great unemployment rates, but that unemployment rate hasn't treated everybody the same. We know the hospitality industry, different industries have been hit harder. So we need to be specifically, as Lieutenant Governor talked about, specifically cognizant of the inequalities of the virus. It affects older people, those with comorbidities differently, and that's what these metrics are supposed to do. We're doing a great job in the state of Utah. I just want to say one more time, it's great to live in Utah. I travel the rest of the country, listen to Senate presidents and legislators there. Everybody would like to be where Utah is today. Thank you.
Thank you, President. Let me just conclude by saying, again, I like the trend. I like the road that we're on. We're going in the right direction. We're not the promised land yet, but if we continue to work together, we're going to get there. So thanks to the work of everybody, and that'll conclude our press conference today. Thank you.
All right, as the governor mentioned, that concludes the press conference. We appreciate our interpreters in Spanish and American Sign Language, and we will be back next week. Just to reiterate some of the websites that we mentioned today, coronavirus.utah.gov/scoreboard is where you can see our data that Unified Command will be using to make decisions. And then the transparency website for purchasing is purchasing.utah.gov/COVID-19. Thank you very much.